cut a check to Chrissy. Okay? For $500 or whatever. And one thing we do need is water, bottled water. I figured 200 bottles would be enough. If we need more, we can go get some.
Please, getting ready to get on.
Cruise in is Friday night. And then Saturday, they have a Hogs and Rods Festival, and that's, we need somebody. I can't be there Saturday, because I've got a lot of other stuff going on, but I want to be out, getting all the food and stuff, trying to help your mom get everything ready. And I also have to help out the track.
Hello, lady.
Hi.
How are you guys doing tonight?
We're here.
Have you guys been studying the in the chapter questions?
Sure thing.
You guys have any questions over those?
No.
Have you guys done all the way through chapter 8 and the chapter reviews?
I have, Danny has, and Kayla has not. She just got her book today.
Okay, cool.
She's here.
We don't care.
Oh, okay. Yeah, I guess. Tell her if you have any questions while you're going over this, you can shoot me a text. Did I ever send you the syllabus?
Do what?
The new girl, did I send her a syllabus?
I don't know. We have some printed out.
Okay. I probably need her email.
You have it.
I do?
Oh, probably. Kayla, yeah, you have hers. Noni's not here.
Oh, okay, okay. So is everybody getting emails in?
I am. Kayla is. Danny is.
Okay, good deal, good deal. So you guys don't have any questions over what we're going to be testing over?
Nope.
So what, 150?
It's going to be 150 questions.
Probably thereabouts, because I'm just taking all the questions from each chapter.
Jeez.
Come on now, not that bad.
That's a lot of questions.
It is a lot of questions. I may try to thin it down, but I'm not going to promise anything. That'd mean I'd have to actually think about it, right? And think about which questions are good. I don't want to do that.
You need to do that.
150, come on, 150 is not bad for two.
More questions.
It's 2 sections.
It's going to take us all a year and a half to finish.
So everybody here at Sayre has also studied. They just had a question. One of their questions was over one of the accidents. It's which one is yeah? Page 131, number 10. Which accident is most likely to for you to encounter a hazardous spill or something like that? Is that what it was? Yeah. If you guess or if you pick the car versus a tractor trailer, and then you go and check your answer, and you're like, "Gosh, I missed that." I don't think you did. If you go read the rationale, rationale actually supports the car versus tractor trailer versus a small truck hitting a tree. So if you run into that while you're studying, where the answer just doesn't make sense, make sure that you read the rationale behind it.
What was the answer? I don't want to look it up.
Because some of these questions and answers are wrong. Some of the answers are wrong in the question. So, Bonnie, do you have any questions over all this stuff? Are you doing pretty good?
No, I'm good.
Okay, good deal. Guys, like I said, if anybody has any questions, while you guys are studying, I know that's a lot of information. Do not hesitate to shoot me an email, send me a text, or even call me if it's a reasonable hour. I'll do the best I can to get you an answer. Now, calling me, you're going to put me in the spot. I might have to call you back with an answer because I'll have to look it up. But email, I'll try to get to you guys as quick as I can because I know that you guys are trying to study for this stuff. So whenever you're going over, if you just don't understand something, let me know. Since all you guys have studied, does anybody object? I know that we had some here that lightly objected to going on into another, like chapter 9. You guys object to going into chapter 9 just so we could continue this pace to get through the PowerPoint slides and stuff? Or would you guys rather just take the rest of the time and study?
We don't care.
I'm here for you guys.
Just do whatever they want to do. It's fine.
Okay. The question was, is there any way to study the bones? The best way that I can tell you to study the bones is there's websites that will give you blank tests, or I was going to do it for you guys today, just make a copy of the book and white out the answers and send it to you. But to study the bones, probably the best thing to do is just find one of those websites that has you just go and label. It's just going to take repetition. You know, most of them, you guys, or not most of them, a lot of them, you guys should know and understand that with the EMR level, you're probably just looking at the main bones. So you're mainly looking at the humerus. You're looking at the radius, the ulna. You might want to understand what metacarpals and carpals and phalanges are. All it is your wrist, your hand, and your fingers. You'll probably want to know, everybody knows what the patella is, right? I get a lot of blank looks here.
What the what?
There you go. I'd probably know femur, tibia, fibia, tarsals, metatarsals, phalanges. I saw where that they were having you guys tell which part were part of the pelvis. I'll look at it. I'll let you guys know tomorrow, but I don't think the test, and I don't think National Registry will either. I don't think they'll separate the pelvis out and actually have you identify individual pieces of the pelvis. Just know that you have the iliac, the ischium, the pubis. What's that? We had you guys were studying. I'm really kind of surprised. They're firefighters, and firefighters don't study. And police officers.
He's both.
Oh, and both. So, muscle wise, once again, just major muscles. I wouldn't go too in depth. And once again, whenever I'm going over and I'll finalize the test tomorrow. And okay, Leedy, I'll look at it. I'll try to cull it down to 100 questions. Is that better?
Oh, we were here.
Are you sure you can't go down to 50?
I'm pretty sure I won't be able to do 50. That'll be hard. It's like a couple questions a chapter. We'll see what I can do.
See what you need to do. Copy the questions out of the book for the 2 sections and know your thing.
Yeah, no.
Order.
I want to make sure the big thing, guys, understand, the big thing I want to do is I want to make sure that you guys are grasping the information, okay? If I feel like if I make it too easy, that I don't get a good gauge of where you're at and kind of what we need to work on. And believe me, I understand this first test is going to be sort of difficult because of how long it took everybody to get booked, how fast the class is going. We're doing 2 sections. I cut down to 50 questions or whatever, and that's 2 points a question if we have 100 points. So yeah. It doesn't allow you to miss as many. But anyway, I'll see what I can do. I don't want it to be overwhelming, the test, but at the same time, I need a good gauge. Because if you and I need to work on it a little bit to get you caught up or whatever, whatever.
I think I'm going to need help with all of it.
No.
How do you pronounce that?
Coccyx.
Coccyx?
Yeah.
Okay.
Coccyx. Yeah, that's Uncle Rico broke his coccyx. Anybody watching Napoleon Dynamite over there?
No.
Gee. Let me see if I can pull up a YouTube video. It's very important to this class real quick.
What's the away from your fingers?
What is it, distal and what?
Proximal.
Away.
Yeah.
Proximal or distal away.
YouTube. Oops. Let's see if YouTube has Uncle Rico. I can't believe you guys haven't watched Napoleon Dynamite. Everybody's missing out. Oh man, my computer's seriously lagging.
Is the study, biological function or the body state of balance between body and body. What are you doing here? For ventilating the patient using a bag bottle mask, taking air quickly into the patient will most likely limit the.
All right, let's do
Don't
this.
make the rest of the test. What term is used to describe the wind acceleration of lips and earth stages of approximately?
All right, this is very important to the test.
What are you doing here, Uncle Rico? Grandma took a little spill of the sand dunes today. Broke her coccyx. What? Since when does she go to the dunes?
You guys over there at Lady, did you guys,
There's a lot.
over there at Lady, did you guys see the flail chest video the other day?
No.
Can you guys see my YouTube video that I'm playing?
Yes.
Okay, I'm gonna pull up a flail chest for you guys. Why did we watch this the other day? Was there actually a reason?
Because you want to show us what.
Oh yes, whenever you're doing equal expansion and excursion, we were talking about this, checking for breath sounds and stuff. This is a flail chest. This is. Oops. Where is it? Let's go back. Let's look at this one. So the flail chest part is the part that is going in, it's a paradoxal movement, so it's going in the opposite direction. And I was just telling them whenever we were talking about assessing for equal expansion excursion or equal breath sound, if you find this, I promise you that the flight crew that you're getting ready to put this, that you should be getting ready to put this patient on, will be impressed if you tell them that they have a flail chest because you found this. Let's make it big. Yeah, you know it's right here though. See it right there.
Maybe it's just because of the angle of the camera.
Well, it's just because you don't have scrapes and scratches all over it. All right, let me get my book out and I'll just go through and I'll try to maybe hit the high points. Stop screen sharing. Try to hit the high points for you guys of what I think is going to be important, not only for this test, but maybe National Registry. Oh, since these guys don't want to go any further tonight, we are going to go further tomorrow night. Be ready.
You know, Big Brother season finale.
Oh man, Big Brother finale.
I don't know about this.
Do you have a DVR?
Yeah, but the season premiere is Survivor.
As we have seen over and over again, you want to have an idea of each level. Everybody's done really well at that. You'll want to know what a PSAP is, a public service or public safety answering point. public service safety answering point. The one that have a good idea what that is. They've done that a few times. But a good point here that out here, ours are kind of stationed in police departments and fire stations. It is still considered for this and probably for everything else. It's still considered a public safety access point. Yeah.
What page you on? Public safety.
Right now I'm on 10. I was on 9. I would have kind of an idea what a tiered response is, and I would have an idea of the fact that the EMS. What's that?
Where are you in the book?
Oh, sorry. Chapter page 10. Ah, my cords just fell down. So did you guys get it? Page 10. Where I'm at.
The item that are blank commonly recognized levels of EMS training. 3 or 4.
Okay, so the question was, is have we decided on the levels of EMS training? Guys, I'm going with 3. Okay. The question is EMS training. Emergency medical service. You have EMT, EMTI or advanced, and paramedic. I'm going to go with 3. 1, because that is what you have to have. Your minimum staffing requirement for an ambulance is an EMT. We established that. The other thing is on the rationale, whenever you go to the page, they list 3. So I'm going to go with 3. You don't need to know I don't think you're going to need to know all 10 of these, but you'll want to have an idea that the classic EMS system goes further than just EMS, okay? It starts with, the regulation and policy, resource management, human resource and training, transportation, facilities, communication, public information and education, medical oversight, trauma system, and evaluation. So it's a lot deeper than just the ambulance that goes and picks people up for the EMS system. I would have a good idea what scope of practice is. I'm just looking through. I'm on page 13 right now. I don't even see scope of practice yet. I just saw something. Yes, I'm almost sure that you'll want to know what the roles and responsibilities of the EMR are. I know what quality improvement is for. I kind of have an idea of how, what allows you guys to operate from the legislation, the EMS agency, scope of practice, protocols, your medical oversight, your agency rules and regulations. In Oklahoma, we call them standard operating procedures, SOPs, or operating procedures. Everybody has a different name for them.
Pocket reference guys.
Uh-huh.
Y'all carry them?
I don't, but there's all kinds of really good ones. They're just a little flip book. They make little flip books. They're really good. They make an EMR one. I think they make it all the way up to. I know that they make critical care. I know that they have nursing ones. They all just have different stuff in them.
You said you should get a stethoscope.
Should you get a stethoscope? Yes, I would get a stethoscope.
Mom's got about 4 or 5 of them.
I'm on page 16. I'm looking at research in EMS. I would just understand that good documentation is how you guys participate in EMS research. That it's important to so that EMS, I guess, could progress. I wouldn't spend too much time on that, but I just have an understanding why. I didn't see scope of practice, stuff like that. I know it's in there, right? Or just skip over it.
Maybe the next one.
Okay. EMR safety and wellness. I would definitely know the stages of grieving or the I would know about your seed safety. I'd know about protecting yourself from violence, cover and concealment, distraction and retreat. I would have a good idea of the difference between cover and concealment. Everybody knows what distraction is and what a retreat is, I hope. So we don't need to spend too much time on it. I would just know what it was. Know that if you want to use placards to identify hazardous materials. It's they're right there in that box. It's not too hard, but we went over some questions over what level of PPE or protection to use in different cases. Obviously, the gorier or the messier the call is, the higher level. They use the childbirth, and obviously you're going to use a gown, eye protection, and gloves on that. So I just kind of have an idea there. Oh, I'm probably not there yet.
It's on 38.
Have a good idea of warning signs of stress. You don't have to memorize all of them. You just have to, kind of glance through it and understand what some warning signs of stress are. They give you 3 signs of obvious death. They're pretty easy, so I'd know those. Dealing with grief on page 38, I already kind of mentioned that, but you'll want to know what those steps are. There's 5 steps. Obviously, you'll want to be able to tell what a good lift versus a bad lift is, so how to use your legs, not your back. Okay, that's pretty big on the EMR side of things.
Emergency moves.
Yes, the emergency moves and urgent moves. Emergency moves are situations that the patient, I guess, could be killed or whatever if you don't move them. So there's fire, danger, different things like that. Urgent moves are you need to move them right now to start treatment, something like that. It's about the best that I could come up with.
Emergency moves on 6 weeks of providing protection. Well, we had one on my text. You got a card. The roll
up against the building.
The roll against the building. The person in the door was unconscious. They needed help. And the person inside was awake. So we needed to get one out to get the other. So emergency move to get that one out of the way so you can get the one that's hurt bad to hurt the word.
Okay.
Yeah.
I'm on page 52 now. This is the medical, legal, and ethical issues. This is a pretty important chapter. There's going to be a lot in it that you'll want to know, not only for testing purposes, but for your practice, or whenever you start working as an EMR. So you'll want to know what your scope of practice is, not necessarily your whole scope of practice, but you want to know what the definition of scope of practice is. You want to know what your protocols are. You want to know what an offline medical direction is. You want to know what online medical direction is. Yeah, you'll definitely want to know the difference in express consent, implied consent. I would be kind of familiar, and if it doesn't show up on any test, great. But I would be familiar on the patient refusal. What makes it okay for a patient to refuse? And as the book has it, there's 3 bullets of why they shouldn't refuse, which is patient has an alternate mental status, patients who have ingested alcohol or drugs, or patient who may have judgment impaired by their condition such as pain or lack of oxygen. You can make that argument on anybody, right? Oh, you're in too much pain, buddy. The HIPAA is important. You'll want to understand when you can and can't give out information. There's some bulleted points on page 57 of when you can share that information. I would know those. Even though we don't use it, I would know what an advanced directive is. We do use it, so know what a DNR is. And a healthcare proxy. And I hope everybody knows what ethics are, has a definition of ethics that would work for a task. You want to know what a living will and durable power of attorney is. Even though we don't use a living will, you want to know it.
Hey, Rob.
Yes.
You know, on the DNRs, you said make sure they're in date.
Yeah.
DNRs don't ever go out of date.
Okay. Yes, you're right. I'm wrong. You got to make sure they're dated though. So if it's not the physician's signature, make sure it's dated. So, I misspoke. Sorry about that. Thank you for that.
You're welcome.
Is that Jacinda?
Yeah.
Hey, Jacinda, what else is on a DNR? Because it's been so long since I've seen one.
They have to have a physician
And 2 witnesses? Okay. Did you hear that? Oh, do you have a copy of one?
Yeah, I remember one was a copy.
Oklahoma might be a little different. I don't think we'll be tested on that. But can you guys see that it says expiration? Let me try to get it. It says expiration date 6 months from signature. So they're saying this one only lasts 6 months, but I don't remember ever seeing anything like that. And I think probably Oklahoma, you're probably correct. Once it's signed by a doctor, it's good to go, right, Jacinda?
Yeah, they can be revoked, but they don't ever go out of date.
Okay.
Well, here, do not resuscitate for the considered valid if they are uninspired and signed by a physician, signed by a patient, signed by an attorney, or signed by the physician.
So do what? Yeah. You gotta understand.
That was a question.
Oh, so
Do not resuscitate orders that are considered valid if they are uninspired and signed by a physician,
yes.
signed by a patient, signed by an attorney, signed by a nurse.
Can you select multiple?
It just says place the check next to the correct answer. Because you would think it would be signed by a physician and signed by the patient.
Yeah, you'd think so.
But you have to have a physician's permission.
But I don't
for a
think,
DNR.
Jacinda, do you have to have the patient's signature on a DNR?
For the physician.
Not if the one doing it.
Not if what?
If the physician is the one doing it, You
Uh-huh.
don't have to.
I got you. What's the answer in the back of the book? So just so signed by physician. Okay. So basically, that physician's signature is pretty darn important on that DNR. Just from my experience with these, the National Registry tests, I would have, I would understand negligence. I'd understand the 4 elements required for negligence. As a matter of fact, I'd know every definition there on page 62. The tort, the assault, the battery, the abandonment, the negligence, the duty to act, breach of duty, and proximate causation. Jacinda, do you remember any questions on your EMT test about any of those kind of things? It's been some. What's
I've
that?
only been to. I said I have no idea.
Okay, no, that's cool. I think I remember it, but last time I took a test was in, well, I retook my paramedic in 2004, I think. But 2001 and then 2004 again. I would have just kind of an idea on how to preserve evidence at a crime scene. I think I saw a question like that whenever I was going through the test. I think it was pretty basic. So, you just don't want to be a jerk. You don't want to smudge fingerprints. You don't want to ruin their evidence. So you don't want to cut through their bullet holes or the stab wounds or anything like that. Oklahoma is different than what this book is. Understand we are testing at a national level. And Oklahoma is different, but understand that there are mandatory reporting. I would know what those are on there. For those that wonder, it's page 66. I'm on chapter 4 now. Everybody see that table on 4.1? On page 72, sorry. No, the table, the 4.1, where it says cardio, neuro. That's not a long list. I would have an idea of what those word parts are. It's actually a very short list. Should be pretty easy. I think you guys probably know most of them already. Cardio, not testicles. Cardio is not testicles, all right? Neuro, okay, naso. We're looking at the thing, yeah. Oro, yeah. Thing related to things in your life, right? Like oral cavity. Never mind. Hyper. Yeah. So remember that, little kid is hyper, high energy, right? Hypo. Them slow, lazy highway patrolmen, right? Hypo. Triple A with a gun. Just kidding. If anybody hanging out with the highway patrol, you guys are pretty cool most of the time. Did they? Nice. In here?
You can smell it when we first got here, real. We see it all the time out here.
So what do they do with the marijuana? They just divide it up between each other? And
No, they'll actually, if DCS got involved, DCS will take possession of it, take it back up to the city, and then just go to the scene and be incinerated.
it'll be redistributed in the street.
Right where the burner, there's a
Nope, because the incinerator has like 8 or 9 layers of filters that go through before it's released in the air, and the smoke comes out here. It's like
So if you guys wanted to in on the story, I was just joking around about Highway Patrol, but they're saying that Highway Patrol made a pretty good sized drug bust before class, and in this room they had it all on a table. There was quite a bit of it. When they first came into class, They could smell the marijuana. Mary Jane.
I'm 50 years old.
Isn't it legal in Oklahoma?
Not yet.
Just kidding. I would have a good idea of the anatomical terms, supine, prone, right lateral recumbent, left lateral recumbent, just because it's good to know, and it'll probably be on a test of some sort. All those definitions on page 74, lateral, superior, inferior, distal. Once again, guys, these aren't hard. Most of them you're going to already know. So if you eliminate the ones that you already know, just study the ones you don't know, okay? So everybody knows what lateral means. Everybody should know what superior means, and inferior. Understand what they mean by distal and proximal. And you guys know what the term means, but just once you know where it's going from, then you're good to go, all right? Some of it, if you can relate to other terms like the dorsal, dorsal fin in a fish in the back, how I did it whenever I was in basic class. I would know the organs housed, or at least the large group, kind of the main group of organs in the cranial cavity, the thoracic cavity, and the abdominal cavity, and the pelvic girdle. I'm going to tell you probably don't need to memorize every organ and which quadrant it's in.
But if you study,
If you're studying it and you get a good idea, I might leave some. When I'm going through, I might leave some of those in there, the bigger organs. Everybody knows their liver's on the right side, right? What's that? Drink too much? No. Oh man, I drank too much. My liver hurts. I will try to keep the anatomy of the abdomen to a minimum. But I really don't think you're going to see a whole lot of that on National Registry.
what organ, what part of the body is also important.
There's like,
Be like finger on that, and then,
Jacinda, I'm relying on you again. I'm gonna have to ask somebody. Do you remember if there was anything on your abdominal quadrants on your National Registry test?
I don't remember.
Okay. Jeez. All right, I moved on to anatomy and physiology. Let me see here. 1, 2, 3, 4, 5, 6. There's about 26 bones there on page 85. I don't think that's a crazy amount of bones to remember.
as long as you got them listed on the side where I can remember,
Fair enough.
that's all I have.
For National Registry, you will not have any labeling that you have to come up with your own. So I will make sure that if there's any bone questions, they're listed to the side. I always call it a fibia, and it's fibula. I'm sorry. Maybe I should study a little more.
It's the S.
Do what?
That would probably be a good idea.
I know, right? What's that? I really think. Let's see. Well, I'll just go look at them. No screenshots, lady. I want to just see something. I'm gonna actually download the test questions here in a second.
Free Taco Bell the rest of your life.
Yeah, no, yeah.
Be free Subway the rest of your life.
What was his
As
name?
long as it's finished on my finger. You know what, I want to really be good? It's Joe's Crab Shack. That's awesome. What he's doing. That's awesome. What's good is a big ass OC crab leg. There's one downtown. I think it's not a Joe's Break. It's, no. Yeah, it's a great one. It's down by the Hamptons. It's not just it's another, it's a Louisiana style.
Hey, Lady, can you see my screen, or did you just see me? Good deal. I'm going to unplug Sarah. Right now I'm going to pull up the test questions. That way I could give you guys a better idea of what's going to be in the test. Yeah, the test I'm giving you. No, nobody sees them.
Well, I tell you what, if you next year's account, that's the test, you tell me what behind the other thing. Hell no. Because there's no test. That's the heart, we gotta have the heart in it.
But at least when I see that question, I know it's a good question.
All right, well, what's the true answer?
If that's what you're doing, and that's a mathematical.
Yeah, that's the answer, so it's called test.
Okay,
You
so
don't have it. It's a buzz, and be like what we used to do today. Put a rubber band in it and.
know where the cervical spine is.
Right. You know where the coordinate sign is.
So know where the cervical spine is.
What's after that one?
Circle up here.
No, have an idea of the pelvis, where it joins the spine. Like I had said before, have a good idea which organs are in the thoracic cavity, pelvic cavity, and abdominal cavity. They have quite, and I'm just going to tell you guys, they do have quite a few questions, or not quite a few. There's some questions in here about quadrant location and organs that lie under them. All right, so you're going to want to know, and here's the reason, and after just reading the question, it kind of makes sense on how they're asking the question. It is so you could develop an idea of what injury they may have by where they're hit or where they're complaining of pain. So, make sense? Yep. So if they got hit by a car on the up, and they have upper right bruising, what are we thinking that there could be? Yeah, we think that they could have lacerated the liver, right? So. I read the chapter. I might throw that question. I don't really like it, but the lymph nodes are part of the blank system. The lymph nodes.
God, we had a question for this.
They're yeah, close. You're so close. You don't have an infection system, but what fights that? Immune. Good job. I'm not gonna throw those out. Good job.
Well, we just done it a while ago, and I remember that.
And guys, so far, most of these questions, if you read the chapter, I think you'll be fine on it. I'm not saying just skim it. I'm saying you need to read it. Yes, they're multiple choice. No, there's no there. If there was, I'd take them out. That's not fair. It's not how you do tested National Register.
So we got 1 through 7.
8, yeah, 1 through 8. But everything kind of that we talked about, the very basic bones, just a general idea of the systems, a general idea of what organs are in what quadrant, what organs are in what level, thoracic, abdominal. I don't really like that question because it's usually slang. Specifically, a muscle is attached to a bone by a, what connects muscle to bone?
What was the question?
Specifically, a muscle is attached to bone by a tendon, B ligament,
Tendon.
tendon. All right. Does everybody know what element of the blood helps with clotting? Okay. Does everybody know what element of the blood or what kind of blood cells fight infection? White. What's that? Yeah. What? Okay, good job. Yeah. Okay. So you guys are doing pretty good. So whenever we just looking at this question here, whenever we talked about the heart, I left a few things out that I guess I probably shouldn't have. So, and it's mainly when you're dealing with the major vessels. So, whenever the blood comes from the body, it comes from the superior and inferior vena cava into the right atrium, pumped down into the right ventricle. From the right ventricle, it's pumped into the lungs through the pulmonary artery. The pulmonary artery is one of the only arteries, or I think the only artery in the body that carries less oxygenated blood. Because it's going to arteries, basically, if you think of arteries away from the heart. So the right side is pumping away from the heart to the lungs. From the lungs, it comes back through the pulmonary vein. It's one of the only veins in the body that carries highly oxygenated blood. From the pulmonary vein, it goes into the left atrium. Left atrium, it goes into the left ventricle. From the left ventricle, it exits the heart through the aorta to the body. So, still pretty easy, right?
They call it pulmonary trunk.
Okay, okay.
Yeah. Well, I've seen the pulmonary trunk, and that's what I wanted to do.
Pulmonary valve, but it shows.
Well, that's the valve, the end of the trunk is the body.
Yeah, they made the top of it, so you can go on with that.
Know the difference between your autonomic nervous system and your, what's the other one? Somatic nervous system? Know the layers of your skin.
That frees me up. Yeah, because we were, yeah, right here.
The canal-like anatomical structure through which, urine leaves the body.
Hey, whatever helps remember the word, well, it's subcutaneous. So that's the basic issue. The dermis is the middle, epidermis is the top. They know it. No, you don't trust me.
They have a lot of they have a lot of the systems questions in here. So, what each system generally does. Your endocrine, your respiratory, your excretory, your
Your skin, digestive system. I'm gonna read that. What it works.
which of the following would most immediately interfere with the life support chain? I'd have an idea of what the small and large intestine do. All right, so we're good there. Let's see. We'll go. I'll pull up another test. All right, so I'm on chapter 6, lifespan and development. I'm just going to go through these questions and give you guys ideas of what to study. I would know your age ranges and what each are called. So like, and your age ranges. So infancy, toddler, preschool, school age. I already told you guys this the other day, but I would definitely know your ranges. Okay, your heart rate, your respiratory, and your blood pressure ranges. I believe so. I'd know your reflexes, your newborn reflexes. I would read the chapter. I'm not going to tell you all of these. Just don't want you guys to read the chapter. Here's another question, kind of over what I told you, the age range and what they're called. So they're hitting that pretty heavy. I'd have an idea of how much, I think it's in the table too, how much sleep and what happens as you age. So that kind of what's the normal sleep amount for each age range. Okay, well, I would know that a newborn sleeps 16 to 18 hours a day. That's the answer. I don't know, but the answer is a newborn sleeps 16 to 18 hours a day. That's the answer. Here's a question over the replacement of the primary teeth, what age it happens. So whenever you're reading, take note of that. I would know kind of what define or what each age group is kind of experiencing. So like they develop peer groups, they worry about their job more and all that kind of stuff. I mean, they just really hit that what age of develop or what development age X years old is.
Hey, Rob.
Yes.
Hey, you were cutting out really bad right there. Can you repeat that?
Yeah. I would have a good idea or what each age and their development stage is. Kind of that, because it's like early adulthood is from, what's the ages? I don't even know. Yeah. 20 to 40 years. And is it 40 to 60 or is mid, and then 60 on is. So I'd have an idea of the development age, and I'd also have an idea of what defines that development age, what they're going through, such as developing peer groups or higher stress at work. There's just a lot of questions over that. Yeah, as a matter of fact, all these questions looking at are over that. I will probably whittle this chapter down. I'm not gonna beat you guys to death with it, but there will be some age group questions there, and there will also be your normal range questions. Okay. But I'm not gonna. There's like 5 or 6 of them, like in a row here, and I'm not gonna do that to you. I might have 2. So.
I thought this chapter wasn't on the test.
I lied to you. That's what I do. Sorry. You didn't study it, did you? And now you're mad at me.
Nope.
I'm sorry. Are you doing National Registry? I highly recommend you do.
Yeah. If it makes you feel any better, I haven't studied any of it.
Oh, okay. Yeah, it makes you feel great. Now, the reason I decided to go ahead and do it is because I'm going to encourage you guys to go ahead and do National Registry test versus the state test. And even though the state doesn't require and doesn't give me time to teach it, it will be on National Registry. And I don't want you guys to fail because we skipped it.
Okay.
Sorry. Yeah, guys, like I said, a lot of those questions are over those age groups, and a lot of the questions are over the ranges, normal vital sign ranges. I'll try to keep it to mainly those. You know, there might be some infant reflex questions or things like that, but I think you guys did pretty well on those when we were going over them. So this will probably be where I cut some of the questions out anyway. Because you're right. I said it wasn't going to be on the test, even though it will be.
Yeah, the hard ones for him to do.
Think about
All right, Chapter 7, Airway. Know your larynx, pharynx, trachea, bronchi. Know that stuff. But the main ones: larynx, pharynx. We talk about this a lot. Does everybody know where oxygen enters the bloodstream? No. What's that big ball of capillaries in your lung? Alveoli, yeah.
Yeah.
Yeah, guys, that's actually important. So, know it.
143.
You guys remember what I said whenever we we're talking about the airway? What differentiates a child airway and an adult airway? You guys remember whenever we we're going over the airway questions and then I guess again in the CPR question? What differentiates the adult and the child airway? What makes them different? I said something pretty specific. Why you don't want to? Yeah. Larger tongue to mouth ratio.
Yeah, there's 4 of them.
Okay. Yeah. Know your ranges, your normal ranges for respiratory rates at your different ages. Know what would be signs of respiratory distress. I think that's if you get stuck on questions like that, think about what's normal. What do you normally do, or what is typically normal, and eliminate those. Okay. Just know them. Know what they are. Know what is there. I feel strongly that the airway chapter is a chapter that you probably should study. Yeah, you should read it and kind of understand it. I do know that whenever you go to take your national registry test, they will have application questions over airway over the airway. The airway is pretty important to life, so I would concentrate on doing some studying on the airway. Lady, I don't know if you guys heard me say this or not, but I am going to be probably very lenient on this first test. One, you guys are going to see how the tests are done. 2, we didn't have our books really in all that great of a time. We had a rush to, it feels like a rush because you guys didn't have books. You guys didn't even get to start working on something. Some of you did. Some of you are ahead. You guys will all have an opportunity to get a passing grade, because you'll have to have a passing grade. especially in the first test. Now, if we get into the second test and you do equally as poor, I'm talking at 50, 60%, we'll talk about what do we need to do to help you do better.
Kayla can't be here on Monday.
Okay. Is she there now?
Yeah. Can she have my mom watch her take the test?
Yeah, that'll work.
Okay.
Your mom? No, that's our EMS director. Her mom is the EMS director. But she's not watching her take the test. She's watching one of the other students. Come on now. Yeah, guys, I'll work with you guys on however I can to do it. And I know Monty. I think he's doing a lot of his stuff from his house. Monty, if you're still on here, I'm not looking at the thing, but if you could be on Monday night, that'd be awesome. That way, you could just put your put your phone on or whatever, so I could see it, and you take your test that way. That'd help me out a lot. But if not, we'll work something out.
My mom said that whenever we have to, on days that we take tests, either her or my sister were going to be here to watch us.
Okay, awesome. That'll actually help out a lot.
I did tell Robert the other day for this.
You did?
You figure it's not free.
Just walked up.
I'm like that.
You guys are terrible. Guys, I would study airway. I'm not going to be lenient on airway, or not. I will, but I'm not going to whittle down the airway chapter because I feel like airway is important. You might just have to be looking up a lot of questions that you missed if you didn't get them studied and find out why you missed them. I think it's important that you guys understand airway. All right, so we'll call it good there. Tomorrow night, I'm tired. I don't know how you guys are doing. But tomorrow night, let's go over the last. I'll look at the last test, and actually I'll go back and look at use a test for the first read. But I do want to go over a couple chapters, or at least one chapter tomorrow, so that we don't get behind, because we're spending 2 days and then a full day to do a test, which that's 3 days. So all right. Any questions there, lady, before we adjourn for tonight?
No.
Okay. Thanks for working with me on my EMS board meeting. I appreciate it.
We have air evac training for the fire department tomorrow night. It's at 7.
Okay. Yeah. No problem. If you want to, obviously study on your own, that's cool. I'll have it on YouTube, so you guys could watch there if you want to. And whatever we need to do. So yeah, that training's pretty important for them to keep their CAMES accreditation. So I understand that. All right. Any other questions?
Bye.
Bye. You're like, no. I do need to go hang out at Lee, though.
I mean, I can bring my